A very good afternoon and a warm welcome to all our viewers. I am Darshika, member of the clinical engagement team at Plexus. It gives me immense pleasure to share that the month of October is going to be a special celebration of Plexus completing 8 glorious years. I take this opportunity to thank each and everyone on behalf of my fellow Dogplexians for your constant support and love over the past years. The Dogplexus team humbly invites you to be a part of the celebration this month and witness the launch of our brand new segments, the all new Master Series, Dogplexus Surgical Suit, ACME, Medi TV, Dogplexus Essentials, and much more. This time, we go beyond our 99 medical specialties in our special 8YC Master Series sessions. These Master Series sessions are planned to discuss the nuances of specialties like genetic medicine, hyperbaric medicine, nuclear medicine, public health, burns, and microvascular surgery. Today's session is focused on essentials of genetic medicine, where experts of this field will throw some light on the specialty, its role in other medical specialties, academics, and its future. Stay tuned till the end, where we also have a brief Q&A session where the panelists will take up questions from the live audience. Without further ado, I invite Dr. Amy Shah, Dr. Snehal Malakmi, and Dr. Nirali Desai. Over to you, Dr. Nirali Desai.
Hello everyone, welcome to the Master Series which is being organized by DocPlexus on the occasion of their completing 8 years. I'm Dr. Nirali Desai, a board certified genetic counselor. I started developing an interest in genetics few years back when I was pursuing MBBS. During my internship, I felt there is a need of more professionals to deal with the vast number of genetic disorders that are prevalent. So after finishing my MBBS, I decided to pursue a career in genetic counseling because I thought that along with making the diagnosis and providing information, it is very important to also provide a proper psychosocial counseling session. But it was not easy for me to find the appropriate courses. Even today, when I am asked that even today, when I say that I'm a genetic counselor, I'm often asked that what is genetic counseling? And this also includes people from the medical fraternity. I feel that there is a lack of awareness regarding genetics as a whole, and because of that, there are very few training courses and programs available for the aspiring students in India. So, today we have this session where we'll be addressing such points and with a very interesting panel discussion on scope of genetics in India with two very well-known consultants who are practicing as clinical geneticists and who deal with genetic disorders in patients and their families. I'm sure this session would be very useful for the aspiring students as well as practicing professionals in the medical as well as non-medical fields. To begin with, we have a presentation by Dr. Amisha where she'll be briefing us about the basics of genetics. Dr. Amisha is based in Mumbai and she's attached with Nanavati Max Super Specialty Hospital, Surya Hospital, and few centers as a clinical geneticist. And she also goes as an honorary at BJ Vadia Hospital for Children.
Thank you, Nirali, so much for the kind introduction. So I'm going to, in brief, start, with an introduction to genetics and how it has evolved and what the scope is. So genomic medicine, basically, the first today. Nirali has already introduced herself. I'm Dr. Ami. We have Dr. Snehal Madhukar also along with us. Now, I would like to begin by mentioning that genetics, the term itself, comes from an old Greek word, which means from an old Greek word called geneticus, which in turn means genitive or generative. And that in turn comes from another Greek word, which is called as genesis, which actually translates to origin in English. So this basically deals with how living things inherit characteristics. And this was very well described by Mendel. And as you can see by the old pod experiment that we are all aware about. And through this, he showed that the genetically determined characteristic of an organism or traits are actually passed on and inherited from the two parents to the children or the offspring. Now, these traits are described by genetic information, which is carried in a molecule called as a DNA. And this DNA was actually discovered in the late 1800s only. So it's a very new discovery, I would say. And thereafter, its structure was formalized by Watson and Crick. That's the double helix that we all know of. And this whole study now of heredity and genes and DNA, along with the variation and the characteristics and properties of an organism, is now all clubbed into genetics or genetic medicine or genomics, as we call it. So, like I explained to all my patients, just to go back into biology and first year MBBS, you all know, like the house is built up of bricks, our body is built up more completely by cells, and the cells have a powerhouse or a headquarter, which is called as the nucleus. And within the nucleus, you have thin strand like pairs of 23 chromosomes. Now, the chromosome in turn is actually made up of strands of DNA. And each DNA, like we know, is a double helix. And each strand actually contains multiple genes which are there. Now, are the most basic of our genetic material, and they pass on the characteristics or the instructions which are required to form certain chemicals in the body, and these chemicals are ultimately the ones which carry out the bodily function. Since we've refreshed about biology, now let's look at the scope that genetics has. Now, we are all from the medical field, I believe, who are listening to this talk, but I would like to highlight that genetics is not just restricted to human medicine, but you also have quantitative genetics, you have ecological genetics, there is population genetics, immunogenetics, you have counselors who deal with genetics, there is cancer genetics as well, conservation genetics, genetic engineering, bioinformatics related to microbiology, research, and so on and so forth. This is just limited. There are many more branches which are there. And the fields where this applies and locations or places where these expertise would be required, again, ranges not just in the hospitals, but you have research institutes, DNA and forensics departments, multiple universities, the pharmaceutical company, food and drink companies, health and beauty care companies, animal husbandry, agriculture, and again, that goes on as well. The scope is increasing as we talk. So just, now that we are aware about what genetics is, we've refreshed our biology and we know what the scope is. Now, let's talk a little as to how one can get into genetics if one wishes to. So I'm going to go in a stepwise manner. Say the student is from a biology branch and he is not on the medical side. So here we are talking about, BSc and MSc students. So in that case, you can, even after BSc, you have courses wherein you can get in to genetics through microbiology, biotechnology, or bioinformatics. Say the person decides to do a postgraduate course, he can do it directly in genetics, that's Master of Philosophy in Genetics, or he can opt for MSc, again in these specific branches with further specialization. You can also do a PhD after your post-graduation in any of the genetic research branches. Coming to the medical field, which is again most of us, you can opt for genetic counseling courses right after your MBBS, or you also have short courses through DNB and other universities in genetics. Following your post-graduation, depending on which field you've done your post-graduation. So say you are from the clinical side, so pediatrics, OBGY, medicine, all of these people can go ahead and opt for fellowship, which is generally a 1-year course. They can also opt for DNB genetics, which is a 3-year course, and then DM genetics, which is generally a 5-year course. Many of these would require entrance exams to be given with respect to specific universities or the specific bodies offering these courses. And yes, you can also opt for a 5-year PhD course, either in pharmacogenetics, which would be through Pharmac. Even the non-clinical branches like anatomy, biochemistry, microbiology can opt for different lab-associated courses which are available after your post-graduation. So depending on the interest, most of us can find something or the other. Now, even the students who have not opted for biology during their 12th and later on, if they have done engineering, there is still scope of going into genetic engineering and biotechnology through this branch as well. And it is quite lucrative. Now, since we've spoken so much about the courses, we should also highlight the institutes where these courses would be offered and the institutes where even job opportunities are available. And there are many national bodies which are there, like ICMR. There is NIMHANS, which all of us know is based in Bangalore. There is JIPMER. There are Manipal universities there. So there are multiple institutes which offer these courses. And you also need to know that other than the government certified bodies, there are also many universities and private institutes which offer courses. But just be careful to make sure, you look up the certification and the acceptance of their certification once you are looking out for the job. But basically what I want to say is, even though it's still an upcoming branch, you have multiple institutes offering these courses. So since we are on the medical side, the two most common professions, like I highlighted in the chart for career options, are clinical geneticists. Now, what does exactly a clinical geneticist do? So these are medical specialists. So like all of us, post MBBS, they help to diagnose inherited disorders, and it's not restricted in age. So even if you do genetics after pediatrics, you will still have patients who are older, for certain conditions and for future planning. So it's across all ages. Plus, they help to identify families who are at a possible risk of genetic condition. Not just that, they will provide further information about the testing and the procedures related to it. And once the test results are out, they will also guide and arrange for the treatment and the management if available for the specific condition. It does not end with the patient. The story continues to the family as well. So to detect, family members who might be similarly affected, sometimes they are asymptomatic, and also how to prevent it in the next generation. Plus, it's not just restricted to pure clinical side. These people, all of us, can also involve in medical research branch, which can be either on clinical or a lab research, which is there. Now, the best buddy, I would say, for all clinical geneticists is actually the genetic counselor. And frankly, we can't do without them. But unfortunately, we are quite few in number. And so the counselors are also fewer in number. So I hope through this, we can increase those numbers. Now, genetic counselors are health professionals, so they need not really be from the medical side. So you don't need MBBS to get into genetic counseling. Even BSc courses are available. Now, these are a bit higher up. They have, both knowledge of medical genetics as well as the art of counseling, which sometimes lacks in us. They involve themselves in educating patients. So they come into picture for both pre-test and post-test counseling. They also facilitate informed consent, before the testing. They help interpret the test results to the family members in a more understandable manner. Sometimes in a busy clinic for a doctor, it is difficult to, give and spend time. And that's when the counselors come into the picture, because they can spend some more time, not just to understand the results, but also to cope up with the diagnosis and the management, which sometimes can be quite difficult for families to understand and cope with. And again, just like the clinical geneticists, counselors are also very much involved in the research side, and they are required whenever there are patients involved for facilitating communication. So now, since we've spoken so much about this branch, anyone who wants to get into a different branch, we need to know what the advantages and disadvantages are. So I'm going to first actually start with the disadvantage and end on a positive note. Now, it's not really a disadvantage, but what I would say is anyone who wants to get into this branch requires umpteen amount of patience. And you need to be skilled to keep yourself regularly updated, because like I said, this branch is ever growing, every second, every minute. There is information which gets updated, and you need to give the updated the updated information to the patient. Plus, getting into this profession can be a bit challenging because it's still upcoming, not very well known. So, sometimes one may find it difficult to find an appropriate course. And plus, the once you get in also, it can be slightly prolonged. But having said that, the most important thing are the pros and the positive side. So now, because it's an upcoming branch, there are multiple openings which are there, because you still don't have as many experts as you need, and the scope is very vast. So both in India and abroad, you have options for jobs. Plus, like I showed, there are multiple areas to be explored. So it's not just human genetics. There is much more. You can go into research, you can go into pharmacogenetics. So it's ever ending, never ending, I mean. And it's a fast progressing field. So, there'll always be some scope, and you will always need more and more experts in this field. And I would like to end on a very bright note that the future is still, very far. And like I said, genomics was the initiation, but now you have something called as proteomics and metabolomics. Now, proteomics involves identification of proteins and their interaction with respect to the genes and within the human body. And metabolomics are small molecule metabolites like hormones. Now we've realized that these all three are actually interlinked, and they are involved in the disease processes and the normal human process itself. And we are now coming up with an inclusive testing and diagnostic methods, which will not just involve genetic reports, but also will go into the proteomics and metabolomics, explaining the effect of the genetic change on the person. And hence, we'll be able to treat these people also much better. Plus, it's not just the diagnostic field which is improving day by day. You now have different tools like CRISPR-Cas9, which is quite famous in the recent times. And these tools will help to come up with new therapies and management options which are available for patients who are down with, who are detected with certain genetic disorders. As we all know, genetic conditions are known, in fact, for not having any treatment which is available. And we always have to counsel the patients that, probably there's not much that we can do. But this is fast changing. And now we have many genetic conditions which have treatments which are available. So the scope, again, like I have kept saying throughout the presentation, is ever expanding. And I would just like to highlight these links. I'm sure you can visit one of these sites within India and internationally. Plus, I would like to mention that, there are two bodies which are there. One is the Society of Indian Association of Medical Genetics. And there is also the Board of Genetic Counseling in India, which is there. And both these are good sites to visit, because they give you an overview of the options which are available in India, and also the courses and the universities which are offering it. Also, the international options are available, and you can definitely utilize these resources for getting more information about this branch and how to get into it.
Thank you, Dr. Ami. It was indeed a very informative presentation. Being a newcomer in this field, I would really like to hear answers to some frequently asked questions from two very experienced doctors in this field, Dr. Snehal Malakmeer and Dr. Ami Shah. Dr. Snehal Malakmeer is a consultant clinical geneticist at Apollo Hospital, and she also has her own private clinic at Nerul. The first question I would like to ask Dr. Snehal. So, ma'am, it is really heartening to see the overall progress in the field of genetics, but up to what extent do you think that it has actually translated into practice in India?
Yes, thank you, Nirali, and thank you, Dr. Plexus, for such a nice session. Few years back, maybe when I did clinical genetics, awareness was limited. We had genetic tests which were expensive. Most of the tests were available as a research option, and treatments were, less. Some of many of them non affordable for patients. But over few years, the situation has rapidly changed. So now we have institutes and colleges where genetic clinics, few at least institutes where genetic clinics have been set up, and the cost of investigations have come down. There is a lot of awareness being generated by our medical faculty, our meetings, and also parents of affected children. They have their own organizations, non-governmental organizations and governmental organizations, which are trying to generate the awareness amongst the common public regarding these diseases and the support needed. So we have now test options, various tests available. The laboratories are here in India, and some of the research facilities they do offer some testing for free. And we have a whole lot of options available for testing through these laboratories and research. Also, as Dr. Ami has highlighted, that some of the genetic disorders do have treatments. So some of the disorders, if picked up early, we can treat them early, we can prevent complications, or sometimes also cure them. I mean, we can restore the child to normal. And some of the genetic disorders, even if they don't have treatment, if we pick up them early, we have, for such chronic conditions, we have options so that we can manage them better, we can have a better quality of life to patient and families. So in India, we have specialties who are dealing with genetics now, and we have almost all the tests option available, which were earlier available in Western countries at quite an affordable price. And we have other options like pregnancy management options. So testing in pregnancy is available at many centers. And treatment options are through 2 3 ways, like some of the therapies which are available, which are costly, like enzyme therapies, bone marrow transplantation, liver transplants. Even if they are available at Apex Institutes or private hospitals, there are options of funding agencies or donations through which the hospitals and medical facilities are helping patients to get these treatments at quite an affordable rate. Then there are NGOs who are supporting the cause. And we now have rare disease policy in India, where government themselves, they are helping setting up genetic clinics across India in some of the institutes. The project is still has just started a few years back, I mean months back. And we hope that this facility of genetic counseling, genetic testing, and management of such patients slowly spreads to peripheries where people need it, where the awareness is needed, and also economic support is available. Also, the expertise is available. So slowly we are doing it. Still, I won't say that we have done much. Seeing the population of India, burden of genetic diseases, we have much to do in this field, and such platforms like we have this session today will definitely add to what we want to do. Like, we want to reach out to medical professionals first, who want to, are just yet to grasp the reach of genetics. And we also want newcomers or students to come and take up this facility, so that we have more trained professionals to reach out to more a larger population of India.
Thank you, ma'am, for explaining so nicely. Dr. Ami, like you very nicely shown in your presentation, can you please summarize the various career options available in genetics for medical as well as non-medical students, along with the available courses?
Sure, Nirali. So like I had mentioned in my slides, say for all medical students who are there, post MBBS, you can definitely opt for short courses, fellowships and diplomas with respect to genetic counseling and also clinical genetics. These are generally offered by, like I mentioned, we have certain boards which are there, like the SIAMG and the Board of Genetic Counselors of India. Plus, they are also provided by certain private and non-government universities and institutes which have been established, like, say, Tata Institute of Genetics, which is there in Bombay. And, you just need to check, regarding the certification status of these courses so that it does not interfere later on for your job options. Plus, following post graduation in the medical field, you can, after your MD in medicine, pediatrics, and OBGY, you have the option of going into clinical genetics through a 3-year or a 5-year course. And those who are still not sure can also opt for the 1-year fellowship courses. Now, all these people can go ahead and practice later on once they are appropriately certified. Also, in certain on the lab side, like if you've done anatomy, pathology, microbiology, you can take specific courses again to specialize in the genetic expertise. And even those who have done pharmacy, you have the branch of pharmacogenetics, which is being offered by certain universities. Now, if you look at the non-medical side, if you are from the biological branches, so BSc and MSc, again, you have similar courses which are there. These are generally more related to lab and research end, and they are also very much lucrative. And if you look at the non-biological sciences, so someone who is taken up maths and gone up to do, say, engineering can still get into biotechnology. And generally, they will be involved in, construction of the machines that we use for genetic testing and for setting up algorithms for the diagnostic arrays that we have in the genetic testing. So this is broadly which is there, but like I had mentioned, and like we've shared, in our last slide, all the links which are there, you should visit them because, this is just in a very summarized form. So there are multiple options which are available to suit all things. So depending on whether you want to, just learn something about it versus, put it into actual practice or use it for your research. So depending on your needs, you will definitely have some of the option which is available.
Thank you, ma'am. I'm sure this will be very useful for all the students listening. We just heard about genetic counseling. So, Dr. Snehal, if you could please elaborate the role of genetic counselor and why do we need more genetic counselors?
Yes. So, see, genetic disease itself is a complex entity. First, we need to understand that many of these people, even if they read somewhere, they may not be aware of the complexities of the disease and testing. So, as we have learned from the slides, that we have professionals who know about genetic diseases, how to diagnose and manage them, and we have genetic counselors. So sometimes because of non-availability or because this specialty itself, is newly starting up, we have less availability of doctors specialized in the fields and genetic counselors. So sometimes doctors themselves counsel about disease also, the reports also, management also. Having limited time in our clinical setup, sometimes some of the aspects may not be covered. Sometimes it is first encounter of patient with such a difficult disease, a difficult entity. So they may not understand in one meeting, even if we try to explain, because a lot of questions in patients' minds first, and they have fear about first to understand. So there are a lot of emotional complications which complexities need to be handled. So we may need separate sessions for regarding answering patients' queries, in detail explaining them about, in a simple language, what their local language they understand about how the disease is transmitted, how it is inherited, what is the exact precise diagnosis, what are the test options available, what are the limitations of each test. Sometimes the report may come negative in a test, so what next test is available. Sometimes even after doing multiple testing, the diagnosis may not be done because we still do not know causes, may not know many genes and their causes yet, or many diseases may not be the science may not have progressed to that extent. So in those negative cases, what to do next, how to manage these diseases. So there are a lot of questions in patients' mind, and hence genetic counselor's role is very important. Apart from this disease aspect, we have to understand that diseases are chronic in nature. They are debilitating in nature. So family suffers a lot economically, so for social support wise. Even if we have funding agencies, the family may not be aware of it. Even if they want to, there are a lot of multidisciplinary management. They may need to go to different type of doctors for different types of management. Sometimes they need orthopedic management. Sometimes from some heart defect management may need cardiologist presence. So this guidance is needed for patients. Hence, this, apart from disease diagnosis and testing, we need management counseling, we need treatment counseling, we need counseling for handling this social and economic aspect to guide patients where to go, where to opt for or seek support for economic guidance of funding agencies. Sometimes we do have some treatment options which are available under clinical research. Like sometimes there is a clinical trial going on for a drug or a treatment option. So we can guide patients to those centers where clinical trial is available for a newly launched option or newly launched drug. So all these counseling aspects are needed, needs multiple settings, multiple meetings with the family. And Dr. Ami has said that it doesn't stop with patients. We have family screening. So involving family members, whether family members are at risk of this same genetic disease, what will happen in their pregnancies. So all these need a good counseling session. So that is how genetic counseling, pre-test, post-test, disease, and all these aspects need to be covered. And we need professionals for it who are trained to know about genetics and their diseases.
Thank you, ma'am. Next, I would like to ask Dr. Snehal that how much essential do you think is the cross relation between genetics and other branches of medicine? And also, if you could suggest some ways in which we can further interlink the specialities with genetics.
Yes, it is a good question, Nirali. And in fact, seeing the Doc Plexus reach out to general practitioners, that we have heard that Doc Plexus has a very wide reach among general practitioners and all medical facilities, and many people attend this platform to know about updates in medicine. So genetic disease itself first is difficult to diagnose sometimes, because not all the symptoms of the disease are apparent when patient comes to the doctor. Sometimes the disease is so mild, sometimes same disease can be severe in another patient. So mild, moderate, and severe, what we call it as in medicine, these are the clinical presentations of the same disease sometimes in different patients. So same disease may appear in a different forms in different patients. So difficulty in diagnosis is the first step. So first dilemma of doctors is whether it is genetic or non-genetic, because there is also overlap of similar clinical presentations with other diseases which are non-genetic. Like it may overlap, it may look like that it is infection, it may look like that this is some trauma, it is something like some acute event or some convulsion, some acute convulsion causing some neurological damage. So there are so many aspects to diagnosis that doctors may not be in first meeting be confident enough to tell patients that it's genetic, because once you utter a word genetic, the family may get hurt. They may feel it is as a taboo on themselves. There are social taboos attached to uttering a word in genetic disease. So sometimes doctors feel these difficulties. So as we have said that we have now available genetic clinics, specialties where doctors can approach for diagnosing this and referring this. Also, we have genetic laboratories who offer support for genetic counseling sometimes. If you don't have in the vicinity a doctor who can examine such patients, you have support from the laboratories and research side also. So interconnection from general practitioners and professionals who are seeing as a day-to-day basis some genetic patients. Then comes testing. So which test to opt for, where to send. Nowadays, we have support from all the laboratories and hospitals for home pickup of samples. We have sample transport, which is very good. Most of the areas in India, apart from very remote, also are covered by courier services. So nowadays, sending samples, getting reports isn't much. Then we have, because of pandemic, we have online consultations, video consultations, and platforms where doctors can interact and put their queries, present the cases if there are queries. So interlinking of all these practitioners with laboratories and specialists in genetics is important. Apart from this, we have super specialties, subspecialties in a subject. Like we have pediatrics, we have pediatric hematology, pediatric orthopedics, pediatric neurology. These specialties get these patients for opinion. So these specialties also need to be aware that there may be genetic component to these diseases. So they also need to share updates in their cases. They need to have updates in genetics when it comes to managing those patients in pediatric surgery. And similarly in other branches, like in obstetrics and gynecology, we have infertility, we have pre-implantation genetic diagnosis, we have prenatal diagnosis, which may be applicable to any general patient coming to them. So obstetrics and gynecologists also need to be aware of many options and testing options and how to counsel these patients. And adult medicine also, we have many genetic disorders coming in same genetic disease, but seen in adults. And we have cancer specialists where cancer genetics applies. So all these faculties and subspecialties also need to come together to share their knowledge in various platforms, update themselves, and how to interlink in their vicinity when the patient needs to be referred, when patient needs to be counseled for various aspects of that disease, or family needs a care. So that is how there is a lot of need of interlinking. And here comes the role of trained professionals. So if we have trained professionals right at basic levels, they can help all these doctors to interlink the knowledge and also to help provide family and patient the basic help.
Thank you, ma'am, for answering so accurately. I would like to ask a similar question to Dr. Ami, that professionals working in the laboratory should be interlinked with which specialties of medicine, and how can we bring together professionals working in the lab, the clinicians, and professionals involved with research together?
Sure, Nirali. So now, like ma'am already elucidated, how within the medical specialties, the different branches should be interlinked. So it does not stop at that. You also have to have a connection or a link between the clinicians and the lab, and also between the lab and the researchers, because it's an entire circle and it will not be complete without. So those in the labs should be interlinked with the clinicians, and they can be clinical geneticists. And since we don't have too many of us, yes, there are a lot of doctors who are sending samples themselves. So it can be anyone who's basically referring the patient to the lab. Also, genetic counselors need to be connected with the lab. So sometimes they are associated with the lab, sometimes they are not. But they are also required for interpretation of the results through the lab. And on the other side, you also need the labs to interlink with researchers, because they are the ones who are going to bring in the new data, bring in new diagnosis, and also help with how to approach with the lab analysis which is there. Now, the clinicians and the counselors will actually act as a bridge to connect the patient with the lab, and in turn help the lab to understand the clinical details and how to utilize them for their analysis. And like I said, the researchers and the lab professionals will also have to, exchange their work, which will add to the existing knowledge which is there of the conditions which are already known, and also for new diagnosis which is there. And basically, how to do this? So it's the responsibility of each of these individuals to reach out to the other, so that we can ensure there is appropriate transfer of information. So yes, the communication between all of these is extremely essential. And since we're reaching out to medical professionals, I would like to say that please do connect with the labs, even if the reports are not up to your mark. Plus, you can utilize, if you have genetic counselors or clinical geneticists in your vicinity, you can utilize them as well, when you're, probably experiencing a roadblock when it comes to patient diagnosis with respect to genetic diagnosis.
Thank you, ma'am. Like you said, it is indeed very important for all these professionals to work together for the betterment of the patients. In practice, we observe that it is not only the patients who need support, but also the relatives of the patients, especially in pediatric cases. The relatives need a lot of psychosocial support. So, Dr. Snehal, do you think that it is important to train the paramedical staff like the nurses as well?
Yes, so we do need, because a genetic disease, as we are stressing it out repeatedly, that it is a complicated entity, a chronic disease, rehabilitation is needed. And also it creates a lot of whirlpools in minds of patients, right? From they hear that they have genetic disease, their child has genetic disease, or they themselves have some genetic disease. And what happens is they during multiple visits, if the professionals around, like in an hospital setup, if the nursing staff, if the paramedical staff, if the laboratory staff, they're not aware, then either they may not be guided well, they may be hurt, or some advice will be given which may not, which may not help or may damage for the treatment. So we need nursing staff training of how to handle these patients. They have small queries, how to, during admission to hospitals, when they come to outpatient departments, how to handle these queries. We also need laboratory staff to be aware that they're handling genetic samples. From ethical and from moral point of view also, we need to protect the data of patients. We need to handle the samples containing genetic information very properly. So sometimes prenatal samples, they are so important. We take prenatal samples, we cannot to take same samples again and again in pregnancy. So such samples need to be handled properly, and security and the privacy of the information needs to be protected. So laboratory staff working in that hospital or working in the laboratory, all these setups, they also need to be aware of some of the basic aspects when patients come to them. So they also need to answer very basic questions. So in a hospital area, definitely we need this support and training to the staff, right? Our doctors, student doctors, and the paramedical staff. Apart from hospital areas or research areas or lab areas, outside also we have many non-governmental organization, NGOs, who are working with parent associations and patient and families for supporting them, for providing them funding assistance, medical assistance. So here also we need people who understand the basics of the disease. Because unless they understand, they won't be able to guide those families whether family testing is needed, whether how much support they will need, whether they will need lifelong support, how much finances they will need, how much financial support they need for rehabilitation apart from genetic diagnosis and treatment. So all these things need training to all these staffs. And paramedical staff, nursing staff, we have some courses for nursing staffs like genetic counseling courses, as Dr. Ami has well put, that we have short courses, online courses from various private institutes nowadays, which can be taken up by those institute doctors. If doctors are attending this session, they should know that they have small courses which they can take up and train their own staff to deal with these things. And if they want to collect the data or put the information in their OPDs or hospitals, they can train a clinical research assistant how to gather a genetic data, how to maintain that data. So this all can be done from these online support or training platforms.
Thank you so much, Dr. Snehal. Dr. Ami, can you please share your views regarding how we can increase awareness among the doctors as well as medical students regarding genetics? And do you think that medical students should be given more exposure to genetics as a subject and to the available careers?
Sure. So now, I'm going to just highlight the importance first of all these things. So genetics, being the basis now for a lot of conditions, we are, also moving towards personalized medicine, which depends heavily on genetics. It is of utmost importance to increase the awareness, amongst the medical professionals. So it's not just the students, even the professionals who are already practicing need to be aware of this upcoming branch. And if we have the option, yes, it should start right, from the MBBS level, and also be included in the post-graduation training as well. And they should not just include the biology of genes and the DNA, but also information regarding the genetic testing, also to give them some idea about how to counsel these patients before sending genetic tests, and how to counsel them after the results come. Also, the doctor should be taught, some basic information of interpreting the test results. So, they don't have the facility of a genetic counselor or a geneticist, they can actually still utilize this, newer facility which is now available throughout pan India. And they should also be aware of the type of patients who will require referrals to, say, one of us, counselors or clinical geneticists, the ones who need genetic testing. So identification is as important as sending the test also. And, how do we make this awareness? So yes, we can have sessions like this. So I think Doc Plexus is doing a really great job in, providing different specialities, lectures, so that, doctors become available of what the upcoming branches are. But definitely we should, have a curriculum now which is inclusive of this genetic branch. It was always there, but the focus was not as much as it is now. So it has to be increased. Plus, you can have interesting things like CMEs and case discussions, which will make it even more, engaging for the doctors. And it's not just a theory session which is there. They will know the practical aspects of it, thus highlighting the importance in their own clinical practice as well. And like I earlier mentioned, we do need many more such sessions with experts to highlight the utility and how to incorporate this new branch into each of our practices. Plus, like ma'am already mentioned, there are many universities and institutes which are offering different kind of courses. So anyone who's interested can opt for these courses. And now, during the pandemic, all of us have shifted from offline to online. So now you have, sitting at home, you can have online courses if you just want to gather information. So they may not really be certification courses, but just to understand this new developing branch. So many can opt for that if they're not interested in certification, just to obtain knowledge and pass it on to their juniors and other staff members as well. So yeah, I mean, yes, the curriculum has to be updated, but that's definitely going to take some time. So till then, we can rely on these short courses and expert lectures, to increase the awareness amongst our community.
Thank you, Dr. Ami. I hope we can see this being implemented in the near future. Dr. Snehal, I would really like to hear your comments regarding the future of genetics in India in the coming years. And would it be beneficial to set up facilities like a genetic clinic in more hospitals and institutes, which in turn can also lead to more opportunities for the training courses?
Yeah, so while linking current status of genetics in India and future, what I would like to say is we are yet to cover up much of larger population regarding awareness and clinical diagnosis. We have very rapidly evolving knowledge in pharmacogenetics and cancer genetics. So we need that upgraded knowledge with the professionals also, like, drug management also is being evolved as per the personal genetic variations. So future in India, if I say that we have to study our different populations, we are a different heterogeneous genetic pool in India. We have different populations, we have different cultures, and we have some groups which, there are some genetically isolated groups. So there is a lot of heterogeneity of when it comes to genetic population in India. There is a lot of heterogeneity. So to understand our genetic makeup, how it is influencing the diseases. So there is a lot of scope for research of genetic diseases in India. One genetic disease, as it is being studied in Western society, and how it really manifests in Indian population. That data needs to be studied properly by coming together of various medical specialties. This is really needed for future, for good data building, because as the treatments are coming up, we should also know which genetic mutations are more prevalent in India. Then what are the treatment options available for our type of patients, depending on their financial capabilities and resources. We have now new policies supported by government coming up, supporting these diseases, these patients, their families. So definitely we have a lot of scope for improvement in taking care of our patients. We have setting up of healthcare in peripheries also. So we in that way also genetics will have a good reach out in the coming future. As we update our courses, we need to, as Dr. Ami has said, if we put it into curriculum, then there would be, I think, more handling and rapid and early diagnosis of such patients. So when I look at it, I see good hope from these all these geneticists and all our professionals in India. We also need to have good communication with our counterparts who are doing research abroad when we bring some treatments here. So while setting up clinical trials, we don't have much clinical trials in genetic per se, genetic diseases. So these areas we need to work out in future. So from genetic training and genetic research and clinical applications or trial, we really need to do a lot of work so that whatever is being evolved worldwide as a new drug or new therapies in genetics, we can bring for our patients early. And today's discussion we are doing for clinical and medical side. So apart from this, genetics, as Dr. Ami has stressed, that genetics has a lot of applications in other human research areas. And apart from humans, we have other genetic research areas and plants and tissues. So we have a lot of things coming up together with nanotechnology and genetics and immunology, which will help other branches, non-medical and non-clinical also. So there is a lot of things which I feel are hopeful in India to work out in genetics and also to make a progress for opening new areas.
As we come to the end of this session, I would request Dr. Ami if you could please throw some light on other areas of importance like pharmacogenetics, plant genetics, and clinical trials of new drugs.
Sure, Nirali. So, like I had shown in the slide which showed the scope of genetics, we now utilize this branch not just for human genetics, but also for other living organisms. So you have your microbiomes, so your microbiology. We have a very good example to give right now during the pandemic. We are all aware of how, we are doing genomic testing for the COVID virus and to understand what variants are coming up and how they are going to behave. So, that is just something which is being highlighted right now, but this has been actually going on for quite a few years. And it's also utilized for, vaccine generation and production and making. Also, similarly, you have genetics related to plants, which is utilized in the agricultural side. So you have, genetic modification of crops to improve the yield and to improve the nutrition, trying to make sure that whatever quality we get is much more enriched. This is also a very important non-medical genetic application, which is now currently being utilized. And, even drugs, like ma'am mentioned about nanotechnology, and, drugs are obviously related to humans, but the field is not purely for medical professionals. You have pharmacists who are involved, you have bioinformatics who are involved, you have technological side which is involved in generating the medicine which is there. And like I again showed in the last slide, you have newer genetic technologies like CRISPR-Cas9, and you also have the concept of personalized medicine, wherein your genetic makeup will decide which medicines would be suitable for you, which medicines might not react well with you, and which medicines will give you the optimum result. So this is not actually just limited to genetic disorders, but it goes beyond genetic disorders as well. And we are seeing that in many of some of the doctors who are logging in would be aware that certain anti-epileptic drugs also require some genetic testing. Nowadays, you need genetic testing even in tuberculosis, where you can make out whether the resistance is there to certain drugs or not. So, there is such a vast scope, it's not restricted just to the clinical side, and there are many options which are available. And these options are increasing day by day. And as these options increase, so will the demand for experts in this field. So definitely someone who's interested can try to explore this area. It's still unexplored, and we have plenty of space to, welcome all who are interested. Thank you, Nirali.
Thank you very much, Dr. Ami. I hope you all found this session very informative. Today's session was planned as an orientation to the aspiring students to know about the different career options in the field of genetics, as well as for medical professionals to know about the basis of genetics and how are genetic practices evolving in India. But seeing the rapid information in genetics, many more such sessions will be required in the future. Today's session was focused on medical aspects of genetics and genetics involved in patient care, but there's a lot more on the research as well as laboratory side and also in non-medical fields. But due to the constraint of time, we could not touch upon more on these topics. We require more sessions with involvement of experts in this area to know more about these areas of genetics. On behalf of Dr. Snehal, Dr. Ami, and myself, I would really like to thank DocPlexus for giving us this opportunity and to all the people out there for listening to us patiently. Thank you.
Yes, I thank DocPlexus for providing us this platform to share our thoughts, and also my colleagues, Nirali for conducting a beautiful interview, and Ami for presenting the facts and giving such beautiful answers. So thank you all, and thank you our listeners. If they have any questions, they can post it.
Yeah, I also would just like to thank Darshika from DocPlexus for getting us on board. And it's a wonderful program, and I'm happy that we can spread awareness about this new branch, which, like Nirali mentioned in the very beginning, that even medical professionals are still not aware about it. So, general population is far off. So I hope this is a stepping stone. We can have many more such sessions.
I would like to thank you all again on behalf of DocPlexus. Thank you, doctors, for such a riveting and insightful discussion. I'm sure it will help our doctors explore different avenues in the ever-changing field of genetic medicine. Thank you to all our dear viewers, and stay tuned for an 8YC exclusive on fallacies during diagnosis for tomorrow at 6 p.m. Till then, stay safe and happy DocPlexing.